I'm VanLaanen, family practice. I'm in family practice, and I chose it because I like taking care of all different ages. I keep my appointments very light. I get to know people relatively quickly, and I have a good sense of humor, and we get to know people that way. I have a bunch of questions that I ask, both medical history type questions and social history type questions, and it's more feeling each other out. What do they expect from me? What do they want me to be able to do for them? And what are their expectations? And a little bit about what are mine? What's my practice style? What do I expect from a patient? Patients should prepare for a visit to see me by having a good health history. Maybe ask your mom and dad and grandma, grandpa, what runs in our family. Also, I ask them to sit and think about what they expect out of me. Are you the kind that just wants a yearly physical? Do you want to see me every 2 years? Stop to think a little bit about what your appointment should be. And I usually talk to them first, and then the exam part, and then together we'll decide what my assessment is and what the plan is. I ease patients' fears basically by explaining what's going to happen, what's going to hurt and what isn't. I had a theory never to lie, especially to children, and have parents say this won't hurt a bit. I say it's going to hurt, but just for a second. Explaining. I think knowledge helps everybody relax. It's a team approach. That I will help you with the parts you don't understand. I do expect you to get acquainted with what your illness is also, and basically we'll work together as a team. I was born and raised in the UP, so I understand the mentality. I don't hunt, but I understand what hunting's all about. In fact, I've been on call for 20-some years for every hunting season because I let the boys go hunting. I have 6 children, which I managed to do while still practicing full-time. People think I'm crazy, but I like kids. So I have 6 children right now, ranging in age from 24, and my baby is 12. Having a big family has helped my practice immensely. I can relate to moms better. I can explain things better. It's one thing to tell them, don't worry, that rash is going to go away, and you're a guy with no children. Whereas if you're a woman that's done this 6 times, they believe me. It lends credibility. Patients' role in their own health care is to find a doctor that they like and trust, so that they're not constantly questioning things. And the other thing for them to do is to go and learn as much about the illness or their condition as possible. And if they have questions, come back and we'll talk about them. But ultimately, they need to find somebody whose personality they like and who they trust, so that we've got a working relationship. I want to be remembered as somebody who's successful at what they did, who was good, kind, and honest.